I'm Colin Doig, consultant cardiologist and physician and medical director with Northumbria Healthcare. The plan for the new Berwick Infirmary is to build a new hospital, providing all the existing facilities on a new site. As we've heard a lot in the news over the course of the last 10 or so years, there is an obesity epidemic, there is a crisis in the number of patients who've got type 2 diabetes. We continue to see significant numbers of patients with cancer, dementia, cardiovascular disease, and a variety of other conditions. We know that exercise and in general good wellness is associated, one, with a reduction in the number of cases that present, i.e. it stops cases happening, and secondly, in those patients who have long-term conditions, it slows down the progression of those particular diseases. It is a win-win situation. There is no plan whatsoever to reduce the health spend for Berwick. What was already been committed and has been committed for several years, that will be honoured and will be spent on healthcare. If we were to use the existing site, the facilities just would not allow for a new hospital to be built on site. This is a wonderful opportunity to try something that is new, that is very forward-looking, that is entirely consistent with the direction of travel that the health service, healthcare and wellness agenda is going in. The vast majority of what we used to do in hospital 20, 30 years ago is no longer delivered in the same hospital environment as it was. There is every expectation as we move into the future. We will continue to see hospitals as a hospital resource, but used in a different way from the traditional model, and that is all to the good of the local population. It's too early to say at this stage, but we are actively looking at the possibility of social housing, assisted living, that sort of thing, which will be a significant additional benefit to the local community. All services that currently are delivered at Berwick Infirmary will continue to be delivered in the new facility. There will be no change to that. If it is appropriate for a number of services to be expanded and to be developed, then it'd be entirely fine for those services to return. It will depend very much on the direction of travel of particular services. We know, for example, that virtual clinics are increasingly happening. We're not asking patients to travel as much as we used to come to clinic. We're doing things far more frequently in a virtual way. That is likely to be a significant way forward, particularly for people who are living somewhat remote to traditional healthcare facilities. We know that there is a major agenda to try to develop facilities closer to the patients' homes. Patients are asking to be looked after as closely as possible to their families, to their friends, to their home environment, and we want to try to work with the local community to deliver that. When we had endoscopy at Berwick in the past, what was required was for patients to undergo one procedure, and then a number of patients had to travel elsewhere to have a second procedure. By having patients travel for their first procedure to either Alnwick or to Wansbeck, we are able to ensure that they only undergo one procedure. That is safer for those patients, and it means that we are able to protect the entire patient journey, and we're able to make sure that the quality control is in place to make sure that the whole system is as safe and as efficient as possible. It very much is a big part of the plan for the future. The preoperative assessment is very important. We recognise that it often doesn't take terribly long and can be frustrating. We will do as much of that locally as we possibly can. The number of beds has been reduced in line with the modelling and in line with the utilage that we have seen over the course of the last few years. Increasingly, we are asked to send people home sooner, and the length of stay has dramatically fallen as social care and other services out in the community are developed. We're increasingly doing work in the community rather than doing them in the hospital. So the modelling suggests that the number of beds is correct. We will continue to review that depending on how the beds are used. By and large, it is better for patients to be treated at home unless there is no alternative, in which case having them in hospital for a shorter period of time would be the appropriate option. But by and large, we are encouraged to discharge patients to their own home as quickly and as effectively as possible, and we will continue to do that. The issue about an A&E, I think, was resolved many years ago, that the number of patients who are required and the experience of the individuals who will be needed to deliver that care are such that it is simply not possible, it is not safe to deliver traditional A&E services in anything other than a relatively small number of sites within a particular region. We have seen this increasingly used across the world, not just in A&E but also in delivery of a whole variety of other specific services, cardiological services, cancer services, to name stroke services, to name another 2 or 3. It is entirely appropriate that these specialist services are protected and resourced adequately to ensure that the healthiest possible benefits for the population are delivered. We will continue to work very closely with the local ambulance service. With regards to access to care, it is clear that the sooner we can get patients to the appropriate medical and surgical care, that is what is of primary importance. There are already existing arrangements that if patients should be transferred elsewhere, then the ambulance service would make that particular decision on receipt or on arrival at that particular patient's house. There has been a long-standing arrangement to transfer patients and relatives from Berwick to other sites within our organisation. That will continue. Please call the infirmary and we will organise transport for you. We will also increasingly be working with the people of Berwick and the region to try to ensure that unnecessary hospital appointments or clinic visits are not taking place, and if we can perform clinics in the area either in person with a consultant or a nurse specialist or as a virtual clinic, then we will continue to develop those facilities. The ambition is still to host a general practice on site as part of the overall development. There are strong advantages to be gained within healthcare for having general practice linked directly to a hospital, and we are very keen to continue to explore that particular option.